Hello everyone and welcome to Ovarian Cancer Australia's Information and Support webinar. My name is Vanessa Elford. I'm part of the support team at OCA. I'd like to begin by acknowledging the traditional owners of the land that we're on and pay my respect to elders past and present. I'd also like to acknowledge that this webinar is being funded by Dry July, for which we're extremely grateful. This webinar will focus on the sexual challenges and issues faced by women with ovarian cancer and the impact that this has on quality of life. We have three incredible presenters who are going to share some valuable information with you. The webinar is interactive, so over the next hour, you can ask questions to the presenters by using the dark blue hand icon at the top of your screen. Questions will be answered at the end of each speaker's presentation. Please note that presenters cannot address individual medical cases. If you have a particular question, please call the Ovarian Cancer Australia Information and Support line on 1300 660 334. This webinar is being recorded and will be posted on the Ovarian Cancer Australia website. For technical assistance, please phone Redback Support on 1800 733 416. So I'm now extremely privileged to introduce our presenters to you. Our first presenter is Chantal Otten, Australia's leading psychosexologist and sex and relation therapist with a background in sexual medicine and counselling. Chantal will talk about the psychosexual impacts of cancer on sexuality, its impact on quality of life, and why sexuality is not lost after a cancer diagnosis. Our second presenter is Dr. Janine Porter-Steele, a clinical nurse manager from Brisbane, whose interests are in women's health and wellbeing following a cancer diagnosis. Janine will talk about sexuality, intimacy, and cancer, and will discuss strategies and resources to manage sexual concerns and make intimacy and intercourse more comfortable. And our final speaker is Alissi Jatkafusi, a 27-year-old woman who was diagnosed with stage 3 high-grade and low-grade ovarian cancer in 2017. Alissi had a recurrence in March this year and is now undergoing chemotherapy. She will talk about the challenges she's faced around relationships, body image, self-esteem and sexuality as a result of her diagnosis and some management strategies that she's found to be helpful. So I'd now like to hand over to our first speaker, Chantal Otten. Thanks, Chantal.
Thank you so much, and thanks everyone for tuning in. This is a bit of a weird experience to do this via telehealth, but it's really nice to obviously be able to have this kind of information provided, and I'm really looking forward to seeing what the other presenters have to say. So I have way too many slides for my time limit, and I'm just going to get into it. If anyone wants to know what a sexologist does, I come from a psychology background, and I then went on to do my science medicine degree and specialize in sexual medicine. I also became a qualified sexologist in Holland, which is where I am from, and I moved back to Australia about 5 years ago now. So I run a big sexual medicine clinic in Melbourne, and I have 8 sexologists who work there for me, and we love, you know, helping anyone and everyone with any kind of sexual problem, because to admit it, we will all have a sexual concern or a question at some point in our life. So we know that ovarian cancer is kind of up there when it comes to female cancers. In terms of the way that it affects our sexuality, we're going to go into it, but we know that it can be extremely devastating. So for 2020, we've seen around 1,500 new cases, and we know that when you get diagnosed with cancer, that is a crisis point. Sex is not something that we're thinking about at that point. If we get diagnosed with cancer, we think about this turning point in our life, and we think about the ways that we are going to have to change from a personal and social point of view, and find adjustments, ways to deal with our new circumstances. How do we restore balance to our lives as well when we have such chaos going on in our bodies? Now, when it comes to cancer, if you have a partner, we also have to look at the problems that might be happening within the relationship, because the partner might start to feel that increased amount of stress. I would feel increased stress if my partner had cancer, and you'd have to look at the change in the nature of the relationship and the family structure alongside the roles that you both play within that relationship. we also have to look at the amount of stress that comes with loss of revenue. So these changes that might happen in a patient's life can essentially lead to emotional distance between couples or however many people are within that relationship, as well as feelings of isolation, anxiety, depression, or inadequacy. 1/3 of partners report that they will also have sexual problems. So we don't really know what that looks like in 2020 because this is a neglected part of research, but essentially there may be a lot of unmet needs because when we talk to patients, we talk to them about what's going on in their lives. We don't often ask, how's this going within the relationship and how is this going for your partner? There isn't someone for the partner to turn to and discuss this kind of conversation. Sexual consequences, we see that over 90% of people with ovarian cancer will have sexual consequences. I always like to say anyone who goes through cancer will have sexual consequences, and it's about 100% because we know that it's not the cancer that often causes the sexual concerns, it's the treatment of the cancer that causes these concerns. So we have to look at the effects of treatment versus the psychosocial factors that are happening within that patient's life and, of course, within the sexual relationship as well. So we know that from the effects of treatment, we can see a lot of different difficulties when it comes to changes in body image that comes with the treatment consequences, loss of sensation sometimes, definitely a loss of sexual self-image or sexual self-esteem, how confident they feel within that sexual relationship. Maybe they will have disfigurement or scarring, maybe lymphedema or a change in body parts that might be a very important emotional representation in the mind of that patient. And then, of course, the, blissful state of early menopause for these beautiful young women that are having to go through such major changes in their lives. We also know that there can be consequences such as pelvic adhesions as well, which of course makes sexual penetration difficult, painful, and climax may be affected. All of this does not equal an erotic circumstance to me. So I really don't like people to be pushed into this kind of notion that they really should be focusing on their sexuality at this point. We really want to focus on maintaining a sense of intimacy and, of course, having a little bit of fun within the intimate relationship and with the partner. And if there is some type of eroticism that comes with that, great. That's my job to help you with that. So, effects of treatment, radiation. We get pain, we get inflammation reactions on the skin, we get lymphedema, we get radiation damage, we get all of that zapping in the body that really takes away the mojo of the woman. And of course, no one feels sexy when we are so fatigued and also when we might be up all night with insomnia because of the effects of the radiation therapy. Again, not a good mixture for eroticism. Next, we have the anti-hormone therapy. So early menopause is such a life-changing event. Menopause in general is a life-changing event for women, and that's something that I work with a lot in my clinic. But of course, we have the hot flashes, the irritability, the depressed mood, and sometimes we find partners just don't know how to deal with this circumstance. We also find that patients don't know how to express to people, this is actually what I'm going through, and this is why I'm feeling a certain way, and this is why I'm behaving in a certain way. So really a huge part of my job is actually giving that patient autonomy to be able to say, you know what? I'm not my usual self right now. I'm just letting you know and warning people around them, or not warning them, informing them of what's going on in their lives so they don't feel like they have to isolate themselves or minimize themselves to be up to standards, up to society's standards of how you should behave. To be honest, I think it's totally okay to behave a little bit foul during this time. It's really not a pleasant time. We also have the vaginal atrophy. We have painful sex. It's dry. We have a loss of desire, and we have disturbances with the arousal process. So the way that the body responds to, I guess, sexual stimuli. Chemotherapy, of course, not only destroys the tumor cells, but damages all the other tissues with a rapid cell turnover. We have hair loss. We have problems in the gut. We have fatigue. We have weight gain, general well-being as well. is a big problem. And then we have, of course, the effect of the hormonal changes and ovarian failure that is caused by the chemotherapy. And most patients say to me, you know what, if desire was like filling up a cup, my cup is completely empty. It's like a well in there. So that's something that we have to work with the partner to let them know this is what's actually going on within your partner's body. We also have to remember that not all of our patients are in a sexual relationship. A lot of them are single as well. So we actually have to be conscious of going, how are you going with this stage of your life? How are you going, perhaps thinking about getting back into the erotic game when you have gone through such an experience by yourself? Is there anything I can help you with? Are you nervous about anything? You know, are there any resources I can point you to? So that's a huge part of my job as well, just giving that person a lot of motivation and confidence to be able to get out on the scene and not worry about the fact that they've gone through this cancer, because we are able to navigate through anything with the right partner. So good questions to ask your patients when it comes to sexuality. What was it like before? Ask them, what was your sexual life like before? What was your body confidence like before? You know, what can we do now with these changes? Were you in a positive sexual relationship? You know, are you single? What about exploring pleasure? What is your background like when it comes to this type of topic? Were you comfortable with it before? Because that will make it a lot easier to be able to discuss these topics post-treatment as well. How do you feel about talking about sexuality? And from my question is, where do you send these women to talk about sexuality as practitioners? And what are the common concerns that you hear from ovarian cancer survivors? So, some thoughts. Once treatment is finished, a lot of these women feel really alone. They feel isolated. A lot of their partners haven't gone through cancer. A lot of their friends haven't gone through cancer. So they feel like they are left alone dealing with these sexual consequences, which are, of course, long-lasting because they've gone through menopause. And, you know, there's often that fear of any type of reoccurrence or relapse as well. Some women are able to return to sexual activity even though they experience a lack of sexual desire or decreased arousal or pain or fatigue. So that's something that me and my team work on. I have a pelvic floor physio that works for me, and we work side by side on treating these patients so they get a holistic approach to their care. Some of these women feel like their partner might abandon them if sexual activity is not resumed. So they might start going ahead with trying penetrative intercourse, which, you know, of course, is extremely painful, and there will be vaginismus sufferers out there, very tight pelvic floors, and a lot of dryness. Others start sexual activity as a way of expressing affection and maintaining intimacy in the partner relationship. I like to tell people to go and have more outer course. For a simple way of putting it, of course, this is a bit of a process, but outer course is any type of sexual play that is on the outside of the genitals. So we also found that partner initiation of sex predicted a greater marital satisfaction for some patients. But when we look at the partner, we know that most partners actually don't know how to approach the subject of touch or sex after breast cancer or ovarian cancer, and may be very confused about what to do next, especially with all these changes that have gone on in the patient's body. So partners struggle to know how to support, but also demonstrate love, also demonstrate desire. I see you, you've gone through cancer, I still love you, I still desire you, I still want to be in this intimate relationship with you, but we need to figure out a way that we can navigate that together. And then there are fears, of course. Will I harm my partner? Will I add pain? And spouses may feel neglected or rejected and may temporarily lose their connection. So we try and aim to getting partners to turn towards each other rather than away. So for patients, when they come in to see you, they're very scared to start talking about sex, and 85% of them will not start that discussion. So that means it's your job to be asking them about sex. And in a study, we found that 62% of women with gynecological cancer had not been asked about sexuality at all. And I think the problem is that sometimes We know, well, not sometimes, we know that there are barriers to addressing sexual health needs in practitioner sessions because a lot of practitioners do not see it as part of their role. There might be environmental or system issues. There might be a lack of knowledge and skills. Sometimes we have to look at our own attitudes, our own values and beliefs as well. And then confidence and comfort and positioning sex as irrelevant or inappropriate for some people as well. So when you're talking to your practitioner, we have to remember that for you, sexuality is a really important aspect of general well-being. It has benefits on cancer treatment. It is a multifaceted construct. And of course, we don't have to be having penis in vagina sex for it to actually be sex. So I think that we need to remember for anyone, sexuality is a huge part of their life, and it's very important for you to be able to go, you know what, I deserve to be having a sex life that suits me and my current circumstance. My job as an oncosexologist is to increase awareness, to look at a new set of skills and facts, to look at a different attitude for you, and also help with treatment skills and try and work as a team. This is my pelvic floor physio who's going to help with any pain that's happening down there and any discomfort. And we work side by side to be able to make sure that you feel confident coming back into the sexual game. And here in my sessions, I really talk about how we restructure the sexual script. So the script is kind of like the menu that you follow when it comes to sexuality. And I help you focus on a new me and a new we as a couple. We also look at medications that you're working with, sexual tools and toys, any type of vibrators, homework, lubricants, how the relationship's working, alongside just normalizing your concern and having a little bit of fun. I can imagine that after cancer, we need to make sure that we're having a lot more fun. Okay, so thank you so much. Are there any questions?
Thank you so much, Chantal, for that extremely valuable presentation, about a topic that I think a lot of people find very difficult to talk about. There is just one question. Someone has said that, I feel that myself and my partner need to see someone like you because we are having a lot of challenges, but my partner is reluctant. Do you have any ways that, how I could convince them to come and see you?
The first thing is, why don't you come in for a session and we work it out together? It's the case for a lot of people that they don't know how to get their partner to start. But essentially, if we lead the way, often our partners will follow. And if they start seeing that you're coming in with new tools and new ways of communicating with them about these needs, then we can do that. The sessions that I hold are hands off. We're sitting there, we're problem solving, we're talking through it, and we're making sure that we're coming up with the right solution for you.
Great, thank you. Very valuable advice. Thanks again, Chantal, for joining us on this webinar. We really appreciate your time. I'd like to now hand over to our second speaker, Dr. Janine Porter-Steele. Thanks, Janine.
Hi, Vanessa. Hi, everybody. Can you hear me, Vanessa? I'm just having a bit of...
Yes, no, we can hear you nice and clearly.
Oh, good. Well, look, thanks, Chantal, because you've made it very easy for me. You covered so much information there. And some of the things that you've said, I'm probably going to reiterate. And I guess, Chantal's a really big expert in this. So some of the solutions that I'm going to talk about, it'd be good to bring Chantal in again at the end of my talk to see if there are other things that she can suggest. I'm also really well aware that each of you who are listening will have come up with some strategies yourself. So hopefully we'll get time to explore those. Also, like Chantal, I've got way more slides than I should have. So Vanessa, you might just have to shut me up at some point. But anyway, we'll get started. So Chantal's already mentioned that the scope of sexuality issues for women with gynecological issues are huge, and it's up to 90% of women with gynae cancers that are affected by sexual issues. And I guess, it's not just women with gynae cancer. it's any woman with cancer and any man with cancer are likely to have sexual issues, which kind of makes it very concerning that as health professionals we probably don't address this enough. So, I think what happens is that at the time of diagnosis, we know that management of treatment is the main goal for people, and so intimacy and sex doesn't become a priority. And I think, in all honesty, you wouldn't want it that way. If you're diagnosed with someone at the start, you might feel, look, just get the cancer treated. I just want to get this sorted out and I'll deal with other stuff as it happens. In the context of sexuality, though, often that moment slips and there are other treatment priorities, or, people are asking you about different side effects without actually asking what's going on. And people often, particularly the women that are getting towards menopause, as Chantal mentioned, often have other issues. So what if you don't want to be seen naked, or you're not interested in sex, or sex is painful, or you're too tired to have sex? And then do you tell a new partner about what you've been through and what's happening? So let's think about some solutions. And I guess, solutions is actually a better way to be focused rather than problem focused. So what I'm going to try and do in the next few minutes is just talk through some of the things that might be helpful for you. So one of the biggest things, I think, is communication, and that's communication with your partner. And the shortest version I could come up with was talk, listen, because that's a two-way street, isn't it, communication? So listening to your partner and how your partner's feeling, and touching and sharing. And Chantal mentioned before, sex isn't always about penis and vagina. Sometimes it's actually about touch and intimacy and connection. The other big bit of communication is with your healthcare team. And we've already mentioned that it's not always easy or opportune. Healthcare professionals don't always bring the topic of sexuality and intimacy up. So, it's thinking up ways that you can bring the topic up yourself. So it might be things like saying, oh, look, I've been given these dilators, but I'm having a bit of problem with them. Can you advise? Can you tell me a better way that I should be using them, or is there another option for me? Or, look, somebody told me with the treatment I'm having, I could get vaginal dryness. Can you advise about that? So it's finding a simple sentence that you can feel that you can actually throw into the conversation and get some discussion around sexuality or managing some of your sexual symptoms. It might even be, look, I'm so tired and I'm really struggling with everything, and it's difficult for my partner and for myself. Can you help me with that? So just finding something simple that you can use in conversation. When we're talking about health professionals, I guess, I'd probably say that could be your oncologist, it could be your nurse, it could be your GP. And Chantal's given a really good example of where a sexologist is really helpful, and using a physio, could be a counsellor, could be anybody, whoever you feel safe and comfortable with. And feeling safe and feeling comfortable is really the important thing. So let's just run through a couple of things. We don't have time to cover everything in detail, but I know that if anybody wanted to talk to me, I'm sure Vanessa could put you in touch with me, and I'm sure the same goes for Chantal in terms of helping with these things. I don't know if you can see that little cartoon with what happened to our sexual relations. I had to just throw that one in because I thought it was really cute, so apologies for that one. I've gone too far, I think. Sorry. So what about menopausal symptoms and coping with menopausal symptoms? Again, Chantal mentioned the significance of those, and it doesn't matter what age you are. If you've had chemotherapy, you could easily have been thrown into sudden menopause. And that all those things, mood disturbances, hot flushes, vaginal dryness, some of those things that really actually are depressing for people. Well, don't despair. There are some good resources out there. And again, if you can get a chance to talk to your cancer care nurse or your oncologist, there are some actually really good resources. Or again, go and have a visit or connect in with Chantel, because I'm sure she'd have those resources. So briefly, one of the most useful sites that I've used in relation to sudden menopause, particularly around cancers, is the Jean Hales Menopause Foundation. They have some really good information on there. And interestingly, if you look at some of the gynecological websites, Ovarian Cancer Australia, there'll be information about menopause on there. There are some really simple strategies, like for managing hot flushes, like getting yourself a chilly towel. So they're little towels that you soak under the tap, wring out, flick, and they stay cold all night and all day, and they can really cool you down quickly. Always carrying a water bottle with you, preferably a really cold one that's been in the freezer. Most hot flushes start from the chest up, and if you just put a water bottle on your neck, that will cool you down and will often offset a hot flush and slow it down. Doing some simple breathing exercises, that can also help with hot flushes. I'm going to talk about lubes and gels in a minute in the context of vaginal dryness, so that will cover that bit of menopausal symptoms. But the thing I would say really is don't put up with it. Go and seek some help. There are lots of people that can help with menopausal symptoms. And sometimes if you get on top of the menopausal symptoms, that can help with things like libido and sexuality in general. So that's a really important thing that you can do. The other thing I think is really important is coping with fear and depression. And that sounds a bit of an odd thing to throw into the sexuality arena, but we know if people are depressed or they're fearful, that's a big thing around libido and desire, and people feel like, what's the point? This little comment from a patient was that all she could think about was that the doctor used the word invasive and aggressive, and that felt terrible to her. That was all she heard in the context of her cancer. Well, the reality is all invasive means is something that's popped out of the cell layer, and what aggressive means is something that's growing quickly. Neither of those things mean that the cancer can't be treated and in some instances cured. But if those are the words you've heard, sometimes it's hard to get past them. So what I'd say to you is, if you're worried about what you've heard, or you're anxious about some of those words that we often use as health professionals, and I really wish we wouldn't, make sure, again, that you speak to your healthcare professional. Get them to go through your pathology again with you. Spend some time with you explaining what your pathology means in the context of you. Sometimes that's a really helpful thing to do when you can understand a little bit better what's going on. I also think being mindful that when you get on to forums and websites, to check carefully that it's one that's facilitated well, and that there are people in the background that if you hear something or somebody says something, that they can help you, because that's where we see a lot of the anxiety occurring for people. So one of the things that sits along sexuality is our body image, and the thing about body image is it's very much aligned to sexuality. It's about how we see ourselves. It's about our appearance, whether we feel sexy or sensual. Scars can really affect people and make people anxious, and can really have an effect on your sexual relationship. So just briefly, think about changing appearance and changing focus. What happens when something has changed? So if you have a stoma or you have scars, how can you focus on your good points? And that's literally it, is focusing on your good points. Thinking about things differently. So women who are in the middle of chemotherapy, often say, oh, I don't feel like sex, I have no hair, I looked really awful. Well, you know, it's important to maintain your intimate relationship as much as you can. So think about things, what makes you feel good? What would make you feel sexy? Would wearing your wig or a really brightly coloured turban, would those things help? Sometimes wearing a little cami, particularly if you've got a stoma, will help cover the stoma for you if you feel uncomfortable with that. There are also stoma pouches. There are all sorts of things you can do. Some women say, oh, I felt really uncomfortable. So wearing, you can get a crotchless knickers, which sounds very sort of out there, but for some women, they feel more comfortable being a little bit dressed up and feeling a bit more like they're sexy. So, you know, dress up, dress down. Focus on what makes you feel good and makes you feel sexy. Fatigue, that's obviously a really big one, and cancer-related fatigue is different from any other kind of fatigue. Most of you all experience that and know it, and it's a horrible thing. So what can we do about fatigue? Well, to be honest, it's managing it. Often people with cancer, before it's diagnosed, will be experiencing fatigue, and that's partly because of the chemical reaction of the cancer on the body. So oftentimes treating the cancer will actually reduce fatigue. Managing other physical issues like lymphedema, which Chantal mentioned as well, making sure you're not anemic, managing the side effects of treatment, all of those things can help, as can increasing exercise. We absolutely know, the research shows us that those women who exercise often have better outcomes, feel better, release endorphins, all those sorts of things, and actually sleep better. Look at good nutrition, look at comp therapies, have a talk again to your health professional to help you manage fatigue. In terms of sex and fatigue, sometimes what actually works is picking a time when you're not quite so tired. So for some people that might be, they feel better first thing in the morning. That might be when you feel at your best. So maybe that's the time to sort of engage in some form of intimacy. Loss of libido. Well, some of the things I've just said apply. So I'll just quickly talk a bit about libido. So we know cancer exaggerates those issues, as does menopause, and that's a really difficult thing to manage. Interestingly, when if you're stressed, it's likely your partner might be stressed, and that can impact on their libido too. So that's why it's really important to talk to your partner as well and have that communication. Again, in terms of loss of libido, sometimes it isn't about having penetrative sex. Sometimes it is that touch, feel and share, and it's that intimacy. And intimacy is a connection. And oftentimes I hear people say, it's not so much the loss of sex, it's the loss of intimacy. And you can have an intimate relationship. It isn't always about sex. And sex actually isn't always about intimacy. So things that you could maybe try and do. Try outer course as an option. So look at hand holding and hugging and touch and thinking about massaging and other ways of showing affection. Sometimes having a quick lovemaking session is helpful, but not too quick, because if you've got vaginal dryness, that doesn't allow for arousal and lubrication. So really it's about having a gentle lovemaking session. Rediscover sensate focuses. I always think that's a bit of a difficult one because people know the bits of them that feel sexy and sensual, and if that's been taken away because of radiation or surgery, sometimes that's difficult, but try and rediscover other things that make you feel good. And look at using other resources such as sex toys and DVDs that actually can allow you to feel a bit more sexy and feel a bit more interested. The other big thing we found that works quite well is scheduling a date night for lovemaking. So actually pick a night, any night, and stick to it. And it sounds a bit cold and clinical, but what women often do is go, I don't feel like it, I'm too tired, maybe I'll do that tomorrow, and then, you think, well, maybe I'll just read the final chapter of my book or watch the last episode of Downton Abbey or something different. So you kind of put the moment off. And one of the big things that happens for women is often around feeling guilty for their partner. So actually scheduling a date night and sticking to it gets you in a bit of a routine, and believe me, it takes away all of that guilt. So perhaps working towards that is sometimes a solution for people until they sort of get back into it again. So let's think about painful intercourse and difficulties reaching orgasm. That's a pretty big deal, and pain is often related to vaginal changes, particularly around radiotherapy. And as Chantal mentioned previously, it's often related to the treatments that we use, the chemotherapy and all those sorts of things. So again, it's about communicating with your partner, taking things slowly, trying for longer foreplay and gentle stimulation. One of the things that happens in menopause is because we whip away all the estrogen, that affects lubrication too, and it affects pleasure and sensation. So sometimes women actually need slightly longer or clitoral stimulation to actually become aroused and to get some lubrication. Again, managing pain, and that might be with medication, that might be feeling less fatigued, that might be using things like lubes and gels and using your vibrator or dilators. I've also put here try ONUT, and I'll show you what ONUT looks like, hopefully, in the next slide. It might have taken itself, it might be on a slightly different slide. So I'm just going to quickly talk about dilators and vibrators, because I have a real thing about the dilators that we dish out to people in hospitals. They tend to be hard plastic tubes, and I'm never entirely convinced that they will work very well for people. And a lot of the women that I talk to say, look, I just gave up on the dilators. They were too uncomfortable. So there are different dilators around, and it's certainly worth you having a look on the internet. The ones that you can see in the image, that hopefully you can see in the image now, they are by a company called Soul Source, and they're silicone, and they come in a really wide range of sizes. You don't have to buy all of them, is my understanding, but you can have a look at those sizes and see which ones you think you might be comfortable with. Also pictured there is a vibrator, and some women find this vibrator really comfortable because it's got a vibrating effect that can be stimulating and a nice feeling for your partner, but importantly for you too. Creams and gels, they're always a big one and often a starting point. There are loads of them out there on the market, and even good old Coles and Woolies sell a variety of them. But just be mindful, creams and gels come in water-based, silicone-based and glycerin-based. And then there are another whole different variety that are estrogen creams, and then there are some different numbing gels. So with the water-based silicone and glycerin-based ones, there's, as I say, there's quite a wide variety. I often talk to people about the water-based ones because people who've been through chemotherapy and are on other treatments, sometimes they're a bit more predisposed to thrush, and a water-based lubricant, you're probably less likely to get thrush with those. And with those, they're all lubricants. When we look at the estrogen creams, they are vaginal, for want of a better word, moisturizers. So what the estrogen cream does will replace the estrogen in the vaginal walls and hopefully help it become a little bit less tight and a little bit more spongy and a bit more pliable, which hopefully will make intercourse less painful. And what I would suggest to people is use an estrogen cream and to use a vaginal lubricant as well. And there is another little product that are little capsules made by Wet Stuff, you can see on there. And these little capsules you put in 15 minutes before intercourse, and they can actually aid lubrication. They're somewhere between a moisturizer and a lubricant, and really useful to use. On that image there with the person with the two hands, that's a product called Owner, and it's 3 layers of silicone which goes onto the penis, or I guess you could try it on a vibrator if you're single, but you tend to have more control over the depth of penetration when you're masturbating and using a vibrator yourself. But those little rings are really soft. They're silicone, and they sit on the penis, and they control the depth of penetration. So you can use 3 rings, 2 rings, or 1 ring, but they sometimes make a difference for people. All the products on there you can see are natural-based products, and some, have, whilst I say they've got different chemicals in, they're obviously designed to go in the vagina, so they're perfectly safe. What you can do as well is go to a compounding chemist and get something else made up for yourself that's specifically designed. Anybody from Toowoomba, I know there's a chemist there that actually makes up something called Screen Cream, which is fairly interesting. But equally, those compounding chemists can make up different products for you, and perhaps recommend some numbing gels. Now, not all products all work as well as each other, so it's worth having a look at what products your health professional might recommend, and whether estrogen is an appropriate thing for you. So that's the gels. And just to reiterate, I think it's really important to use a combination of a vaginal moisturizer and a lubricant where you can. Other things that you can do to help positions and exercise, and just to be very brief about this, pelvic floor exercise is obviously really important, and I know Chantal uses a pelvic floor physio. I actually think that's one of the really important things that you can do. I think it's not a one person can necessarily sort out somebody's sexual issues. I think it's a bit of a team approach, particularly around talking about it and the physio. In terms of the resources I've shown you, I just want to say this is a really useful resource, the Pelvic Hub. Emma's actually a physio, and a lot of these products I've just mentioned to you, she does have on her website. And finally, I guess it's about having realistic expectations, and I swear there's more than 2 people on that trolley. And sorry, there's so much information, so I hope you've got something out of that, and good luck with it all. So I've finished, that you'll be glad to know, Vanessa.
Oh, no, you could keep going. That was absolutely wonderful, Janine. Just so informative, so helpful. So thank you so much. We do have one question. It is, are there any particular products or lubes that you would recommend? There are obviously so many out there. Is there any particular ones that you would recommend?
Oh, look, as I say, I tend to sort of go for the more water-based ones. You tend to have to apply those a little bit more often than you would the silicone and glycerin. But I suspect it's a bit of a matter of preference whether you go for something natural. So natural products would be olive oil, or coconut oil. Just make sure you keep your olive oil and coconut oil that's in the bedroom separate from what's in your pantry, though, because when you have guests, it's a bit of an issue. There's a really nice little product called Olive and Bee that's really natural. But the other products, they're all appropriate. But I guess it's finding what works for you. One of the important things I would say is patch test first, because I have had people say that they found stinging or burning with some products that they've used, and that hasn't happened for everybody. I think we're just all different. So it's probably worth just trying a few different products to see what you think is most comfortable.
Fantastic. Thank you so much again, Janine. We really appreciate your time and all that wonderful advice. So we'll now move on to... Thank you. Thanks, Janine. We'll now move on to our third speaker, our final speaker, Alicia Jatkafusi. Thanks, Alicia. Are you there?
Yes, I'm here. Oh, hello?
Yep, we can hear you.
Oh, you can hear me. Sorry.
Yep, all good. Go ahead.
So, hi, everyone. My name's Alicia. I'll just give you a quick background of my story of how it all happened. So I was diagnosed with stage 3 ovarian cancer, both high and low grade, in 2017, and I was 24 years old at the time. So I also had a massive surgery during that time, which included a full hysterectomy and half of my large bowel removed. And then throughout 2018, I had 6 rounds of chemotherapy. And once my chemotherapy finished, I went into remission around August 2018. Well, now, unfortunately, in March, April this year, I had a reoccurrence. So a lot has happened in the past, I would say, nearly 3 years. Especially being a young woman, it's been quite challenging. The 2 topics I'll be covering more personally for myself is the challenges that I faced, self-esteem and sexuality. But for now, I'm just going to go over the challenges that I faced with self-esteem. So when it came to self-esteem, going through chemotherapy especially and having so much bits taken out of you, especially having a full hysterectomy and all the scarring, I struggled for a bit with my body image. I used to say I would look into the mirror and everyone around me would be saying, "Oh, Alicia, you're still beautiful," but I did not see that. All I saw was just cancer. That is the best way I can explain it. And I struggled for a while, I guess coming to terms with just my body, with how I felt, being confident within myself. And it was hard also just being, at 24 at the time, having this disease. What do? I don't feel like how I used to feel, because before my diagnosis, I was super confident, everything like that. I was living life, and now I just felt robbed. So what helped me was just my body image and just being confident within myself, just being a woman, was to really embrace my journey. I've been given this insidious disease, and I can either dwell on it or I can turn it into a positive. And it was really retraining my mind on how I thought about myself as a woman. I really struggled with having the full hysterectomy later on throughout my diagnosis, and that was not being able to have kids, which really, that really brought me down. So having not being able to have kids, that did not help with my confidence whatsoever. So it was really just embracing the journey, having ovarian cancer, because obviously there's nothing much I can do but was to keep living. They're the challenges that I faced with my self-esteem and accepting my scars and showing it. There was a time where I became quite depressed. So with what helped me was actually dressing up, especially during my chemo and even after my diagnosis, was dressing up and really putting effort into my appearance, like putting on makeup, because I felt like, well, I'm stuck at home in my pajamas. That's all I'm doing. So if I just dress up, put on some makeup, look in the mirror, own it, go out, enjoy life. Which was really helped me personally was going out and socializing, even just going out for a few drinks with friends, and also turning to my support network, such as my family and my girlfriends, which is what really helped. And also, for me to overcome all of that was really embracing my journey and being open about it. I know some women they can't do that, and that's fine. But for me, it's just being open and sharing it on social media, and then meeting other women who have ovarian cancer and being able to talk about it, and having someone to talk to who understands what you're going through is what helped my self-esteem. And especially being a young woman and seeing, you know, all the other ladies who are around my age, I struggled with that. But I was able to come through and talk about it. And, yeah, just being open and sharing, you know, my challenges. And what helped me was just going to the gym, changing my the way I eat is what helped me. And, yeah, so that was my self-esteem, was just pretty much owning and embracing and just feeling beautiful is what helped me get through my challenges. But now I'm going to talk about with the sexuality side. I do get asked quite a lot of, you know, what is sexuality like of having, like when you have cancer, ovarian cancer. Beforehand, before my diagnosis, I was fine with my sexuality. I was quite confident in everything, even like just having sex, I was fine. Even talking to men and all of that, I was okay. But once after my diagnosis, and my doctors did say that, you know, with your surgery that you've had, your full hysterectomy, obviously you have no hormones, which does affect your sex life, and also your emotions and how you feel and all of that. So for a while, I was still able to talk to men, but I was more worried about, will a man, I guess, find me attractive, as in love me with everything that I have going on. Like, I've got so much going on, and also not being able to have kids. And I struggled with that, which I mentioned before. So with sexuality, and also I wasn't confident in having sex. As a single woman, I was too scared to have sex just because of what I was told, and also my sexual desire. I had lacked in my sexual desire. I just did not feel it at all and not wanting to do it. So despite with what all was going on during this time, and worried about what it would be like going into a new relationship, which fortunately did happen. I met a lovely man who currently lives in America, and we've been in a relationship for about 2 years. We are actually currently in a situation where we aren't able to be physically together, yet to practically have sex or have that physical intimacy, but just being able to be with someone who understands and I feel comfortable about talking to about everything is what helps with my sexual desires, and he understands. Unfortunately, yes, we cannot be physically together, and just what the lovely doctor who had spoke before me, it's not just about sex, it's also about intimacy and having that connection. And I wasn't sure, when I was single, will I be able to have that connection, not just sexual or physical, but also emotionally, which I do currently have with my partner. So he has helped me with my sexuality, my sexual desires. I actually currently use a sex toy, which helps with my sexual desire, I guess, to increase my sexual desire, if that's how I can call it. As I did say, during my single days, I did lack in it, and I think it's just because I just did not know what it would have been like being a single woman, I guess, having ovarian cancer and being able to be with a man. So, yes, it was really just having someone now who I can just talk to and who I can be transparent with and tell everything too. So, yeah, those are the challenges I really faced for myself, was my sexuality, but my big one was my self-esteem. Having ovarian cancer, it just robbed everything out of me, and I faced so many challenges, not just from body image, but for how I feel about being a woman, and I felt less of a woman because I had the full hysterectomy. But it was just coming to terms and accepting my journey and saying, this is it. I either dwell on it or, like I said, I keep on pushing, and I chose to keep on pushing. I do have my days, and I'm currently going through chemo at the moment, and we all have our days, and I have my days, but I'm here. I'm able to talk about my experiences like I am right now, which I'm very thankful. So, yes, those are the challenges I faced. I hope that was covered in everything, but thank you. Thank you, Vanessa.
Thank you so much, Alicia. That was fantastic. And like you said, just getting up and speaking about, your diagnosis and your story and your sexuality, that takes a lot of courage, especially for someone so young. So I really, really appreciate it. And I know everyone on this webinar would agree with me. You're so open and honest. We just do have one question that has been posted. Have you told your partner about your diagnosis? And if so, how did you bring it up?
Yes, I did. He pretty much knew straight away. I just said, look, this is my story. And I told him everything about it. I've got stage 3 ovarian cancer. And, yeah, I was just so upfront because at that point, it's either, you either take all of me or you don't. So I pretty much told him over the phone that, I've got cancer and this is my story. And obviously 2 years later, we are still together. So, yes, I hope that answers the question.
Thank you so much again, Alicia. Really, really appreciate your time and, like I said, just being so open and honest and sharing your story. So there's no more questions for now. So once again, I would like to say a big thank you to our speakers, Chantel Otten, Dr. Janine Porter, Steele, and Alicia Jack-Kufussi. We really appreciate the information that you've shared and the time that you've given us this evening. Thank you, everyone, for being on the webinar, and we really hope that you found it valuable. You will receive an email with a link to the recording of this webinar in the next few days, and it will also be posted on the Ovarian Cancer Australia website in the next couple of weeks. In a moment, you'll be directed to an evaluation form. It's very, very brief, but if you could just take a moment to fill that in because your feedback is very important to us. It helps us to plan and develop future webinars. So if you have any other questions that you would like addressed, please don't hesitate to contact our information and support line on 1300 660 334. This is obviously a very challenging time for everyone, more so with, with what's going on around the world. We know some of you might feel that you need that extra support, so please don't hesitate to contact us. Thanks again, everyone, and we hope to see you for our next webinar towards the end of the year. Please stay safe, stay well, and enjoy your evening. Goodbye.